Ways and Means to order.
I'd like to call the Human Resources to order.
First thing on the agenda is a consent agenda, approving these which have been approved in other committees before. So if we could have a motion, please.
Motion for Ways and Means.
I'll second Ways and Means.
Okay. All it is Ways and Means for this one.
Is there anything meant for
Is there any discussion on any of these? Yeah.
Just a question on that temporary clerk for public health. Somebody told me that the person's left and gone to Florida. Do we have anybody in that position? That's the last item on the consent.
Don?
It's a temporary position, and she's only gone for about a month, so she'll be returning, and she'll do the work.
I just wonder when we do this, when we can afford to let somebody go for a month, and how critical what it is we're trying to accomplish, that we can have that break. I just was curious.
All in favor?
Aye.
Opposed? Carried. You want to do these, what's the most?
We'll go to number 2, amend the resolution number 218 of 2004 for private duty nurse and personal care aide contracts with Department of Social Services. I have a motion.
So moved.
Is there a second? Mr.
Need Ways and Means.
Motion, Ways and Means?
Motion.
Motion.
Second.
Second. Is there any discussion? Ways and Means?
What are the contracts, what are the changes?
Well, I think Tim's here to talk.
Tim can tell us.
Yes, there's no real changes in the contract. These are contracts that we've had. I noticed in the resolution that we actually had nursing rates established, of which we have no control over. The state sets those rates. So, and I also noticed that it's just a small clerical error in one of the numbers. That's all.
Yeah.
Their personal care aide, like you said, Tim, $17.52 an hour, so that may not be the current rate. The nursing supervisor,
That's the same.
why do we use a nursing supervisor?
We don't, that's the contract that we use as a nursing supervisor.
To render the services?
That is supervised, yes.
Is that what, so the nursing supervisor is supervising the personal care aide, is that what we're buying?
That's correct.
Tim, you gotta speak up so we can hear you. I can't hear you very well.
I will.
My question was, if we've got, what we're doing in this is the personal care aide level 1 and 2, and the old rate established by government or whatever, $17.52, and a nursing supervisor for $70.96 an hour. I wondered why we're buying contracting for a nursing supervisor. And I think what Tim said is that's the person supervising the aide that we're getting. So we have to,
We don't, we at the county, they bill Medicaid directly. Okay, there's no monetary transaction between DSS and these contractors. They bill directly through the netting system.
so this is people that are on Medicaid, that you're just authorizing this provider to...
We're required to provide the service. The provider of the service bills the state directly.
And so are there other providers other than these two that provide these services to Medicaid, or these are the only ones they use?
They're the only ones we use for our particular service.
And are these rates set by the state?
They are.
Just tell me, are these the only two providers there are, or how do we lock in on these two?
I don't know how, we've always had them. It goes back prior to.
All those in favor?
Aye.
Opposed?
Ways and Means, all in favor?
Aye.
Opposed? Carried.
We're going to skip number 3 for now and go to 4. Authorize appraisal of the country manor. May I have a motion?
Motion.
Mr. Bono, seconded by Mr. Hendricks.
Motion for Ways and Means. Bruce and Bernie. Discussion. Yeah.
I'm not sure what was in public session versus executive session as as far as country manor is concerned, so.
If you ever think that something is an executive session, we'll get a motion.
No, I'm going to be careful. But we have interest in country manor. I don't think that that's a secret. And there's people, firms that have voiced interest. So is this getting the appraisal, because it doesn't come without expense, is in order to further negotiations? I don't know what the purpose of the appraisal is.
That's correct. We're trying to find out the true value of what the property is right now.
So the concern that I would have as we go forward with this is that is it an open, once we get the appraisal, it is an open field in negotiations? Is there going to be an RFP? Not for the appraisal as much as it is what we might do with the information from the appraisal? Or are we in negotiations with specific parties?
That's not what we're voting
I want to understand why we're approving the appraisal.
We're not at that point. Right now, we're concerned with getting the appraisal.
But we are at that point.
Well, it doesn't matter whether, it's one or all, you still have to know what the property's worth.
All right.
What's
So
the
last
what's the
time we had an
difference?
executive session, this is newfound information that we need the appraisal. Since last time we met, there was no conversation about it. All right, I don't have a problem finding out what it's worth.
Anyone else? Mr. Anderson?
I do believe there was a request at the last meeting for an appraisal.
I think Mrs. Rose made that request.
I think I was told that it wasn't necessary.
We're going to do it.
Good, thank you.
All those in favor?
Aye.
Opposed? Carried for human resources.
Ways and Means, all in favor?
Aye.
Ben, you like? Ben, you like?
Not sure of the issue.
On appraisal for the country manor?
Yes. All right.
Sorry.
Number 5, child date.
I can take it to him.
I'd like to ask, Doc, if you can give us a couple minute update on the job?
Since our last meeting, we've continued to have discussion with the New York State Department of Health, finding out how our proposal for closure of the long-term care in Shaw is progressing. We were not on the agenda, as you know, for the meeting in February, and our next chance then would be the April meeting. And the other issues were what steps we could take with our patients that we do have that were compliant with the closure plan that requires that nothing can really be done until the closure plan has been finally approved by the Public Health and Planning Council. In light of that, we've discussed, so we would be ready for 9 patients. The different options that these patients would have were the closure plan to be finally approved. And the the possibilities for patients include transfer to another long-term care agency, transfer to a nursing home, or application for and approval for a nursing home transition and diversion Medicaid waiver. And the final one, we had the director of the Central Regional Office for the Nursing Home Diversion Waiver Program come and review all the charts of all of our patients, just so we would be aware of what the options were and how we could inform the patients if that time ever comes. That's as much as we have done. We've prepared for the LICSA approval by getting together all the new policies, procedures, and stuff that they have that will be approved at the same time as our closure plan, presumably to be approved. Those things both happen simultaneously.
There's no March meeting, is that every 2 months?
The February meeting mostly is like a big committee meeting, that they approve everything at the March meeting, and then in April, then they have another meeting to approve what happens at the following meeting. So it's sort of a 2-month transition for each step.
Thank you. Yes.
I'm trying to understand is, so the closure plan, I'm sorry. The closure plan is what we were doing before there were any changes in the way the Department of Health were reviewing new licenses. We were doing closure plan anyway under our agreement with at-home care, is that correct?
We're basically doing a transfer plan.
So when Dr. O'Keefe was mentioning closure plan, is there a transfer plan still in the works, or is there only a closure plan?
Bassett at-home care is looking at a closure plan from us instead of a transfer plan.
But we didn't change any part of our agreement to say a closure plan, did we? We have an agreement that talks about a transfer plan.
Correct.
So how do we get to a closure plan without?
That's being
creating a
discussed
transfer
between the
plan?
county attorneys, and hopefully we'll have that pretty soon, Mrs. Rose.
So a closure plan has gone forward, but it wasn't voted on by the Human Resource Committee?
Correct.
Just by some oddity, if it were to say no, what would you do if they did act on it? I mean, is it not, I'm
We're
not,
back to
I
square,
recognize this.
we'd be
approval
back to
by
square
approval.
one.
I beg your pardon?
We'd be back to square one if it's not approved by the legislature.
But why wouldn't we just act on approving it? I guess I don't understand why we went ahead with the closure plan without asking the group to approve, and they may well, I don't have any doubt in my mind that it would be approved, I just question why we're not doing it.
I didn't think the timing was right, to be honest with you. I was thinking next month, in March meeting. That's just me. If the committees want to do it now, that's fine with me too.
So the attorneys are discussing the transfer plan, and whether there's even a transfer plan.
No, closure plan.
We have a transfer plan,
Correct,
and nobody's discussing that anyplace.
correct.
Okay, all right, I got it, thank you.
And we don't have, we were hoping to have that, we don't have that yet. But should have it very shortly.
Okay, thank you.
Okay, there's no vote on this, it's just information only. Number 6, advertise for Office of the Aging Director.
I'd like to take some, Steve.
Sure.
We took a very serious look, I think people know that we took a very serious look at trying to combine different departments. Myself and Tim and Mary and Steve worked at it for probably a month and a half, talked with several other counties, investigated the other counties, truly believe that there's no savings. You know, when you're looking at 90% reimbursement for Mary's salary, benefits, et cetera, you're talking over 90%. Tim and I and the rest of the group sat down, did the math on that, didn't see a savings. We were perplexed. Tim was nice enough to call some of his buddies around the state and say, you know, geez, you guys have all done this, where's the savings? There's no savings. So we believe we can't bring that forward.
The reimbursement would be less than DSA.
Right, so our belief is to move, our recommendation is to go forward and advertise for Mary's position. She's leaving us April 28th.
Can I understand why the reimbursement would be less? Is it reimburse the function, or I mean, you're gonna have the function if you, I don't know how you, if the function was being done in social services, is the function reimbursed at 90%?
In aging, yes.
No, I'm saying if the function was done within social services, but the function was there administratively,
75%.
just because it's under the organizationally,
Correct.
because it's under social services?
Right.
How about any ancillary staff? How much ancillary staff is there in the Office of the Aging, besides the director?
Steve, 8? I mean, there's probably 45 part-timers.
Yeah, you got a lot of part-time.
Well, I'm talking like within the office, not
Yeah,
drivers and things like that.
My guess is 8.
And there would be no efficiencies in coverage or any of
No.
that stuff?
We will be coming back probably in a couple months with another alternative, but we're not ready at this time to bring that forward.
And as you debated it, was there any document put together?
I think Tim's got some information from some of the other counties.
Well, I mean, in the way you reviewed it, was it all sitting around verbally, or was there any kind of a report done?
Now, it's pretty simple. We did the math on the salaries and verified that with the state, verified that with the other counties, and it just didn't add up. But it may add up with another department, which we'll hopefully bring forward next month, if we get some word from the state.
May I have a motion on this? Lenny, seconded by Mr. Shaw.
Ways and Means. Bernie and Kurt. All in favor, Ways and Means?
Aye.
Opposed?
All in favor of
Carried.
Human Resources? Opposed? It's carried.
Do you have any other in your?
Oh, wait, I can't.
Oh, wait, you got to do
I
number
can't. I got to do
three.
number 3.
Oh, I'm sorry. You just stay open to all that.
Okay. We'll just
That's
stay open
legal.
and do bats and go through it at the end.
Mr. Chairman, I have something for human resources, an open item, whenever.
Well, we're gonna stay
I
open.
said, okay, thanks.
Okay, Ways and Means number 7, approved court cleaning contract, which is, what? Jim?
82,000, we're asking for $82,557.
Up or down from last year?
Up a little bit.
Who does that?
Our cleaning staff.
Motion, Ways and Means. Bernie, second. Rose, any other discussion?
Mr. Chairman, Jim did help me by sending me a lot of stuff that's ready for this meeting. We've had a sidebar conversation about getting every penny we can out of the court system. I think they work hard to do that. The cleaners, I talked to a few on the way in, because initially we thought they were in the retirement system, and certainly some of them are. So I guess as this gets approved, I think Jim said that he'll have Bernie review Jim on the retirement costs to see if they're
Correct.
capturing that. Thank you.
All in favor? Opposed? Carried. Number 8, approved contract with YMCA for law enforcement contract.
I think everybody realizes this is something we've done for years. It's a $30,000 state grant, no cost to the county. Basically child sexual and serious physical abuse cases.
We'll second.
Any other discussion? All in favor?
Aye.
Opposed? Carried. Number 9, authorized leave of absence for Mary Sullivan.
So move.
Second.
I'll second.
Is there any discussion on this? Yeah.
Just trying to understand, and Jim and I had a few emails on this. This would be in the budget as a non-funded, a non-funded vacancy, is it, Jim? So that we pay her and then they give us back, or how does it work through the books?
Yeah, we get, and I did get an email late today that said, I haven't been able to verify it, that the retirement, Social Security, Medicare, wages, and benefits are all reimbursed by the state. So we pay that up front, and it's reimbursed back to us.
By the union.
Yeah, and for the new guys, this is something, it's New York state law, to be a member, an officer of CSEA, you have to be a local employee. So we've done this since 1986. I mean, I'm not saying good or bad, I'm just, that's what,
She's Vice President of Union.
Vice President of CSEA, which is a very big position.
But it's reimbursed by the union, right?
Correct.
Not by the state.
Did I say the state, Pat? Sorry
So
about that.
Jim, so when we looked at our budget last year, was there any tax levy to support this? I guess I'm
No,
wondering.
zero.
Okay, so it's zero, so we get we experience it, but we get the money, it washes it.
Right.
Correct.
Okay.
We should have probably froze her salary in 1986.
Does she get raises when everybody else gets raises?
Yep,
Yeah.
Wow. And she's gonna get a.
she's a member of CSEA.
But there's also a temporary person that fills that position, correct? Mary's?
No, we created that a few years ago.
Well, yeah, okay. Yeah.
Is there somebody in it temporarily?
No,
No.
We had something, I remember.
we did. No,
Yes.
we used to.
So you wouldn't be.
Old age. Probably.
Approve annual report of 2011 standalone workers' comp plan.
Yep, I think I put it in everybody's mailbox, that and number 11, both the annual reports that we put out for our.
You got it, Pat?
Yeah, we can do 10 and 11 together. Motion, please. Motion. You got those, Kurt and Bernie?
Yep.
Any discussion? All in favor?
Aye.
Opposed? Carried. Number 12 is approving a charge of a late fee for the town of Warren on workers' comp payment. They didn't pay the workers' comp on time, and there's a penalty for doing that. What's the percentage? 2%?
2% for the first month, 1% each month thereafter.
Are
I
they
believe
current?
we'll get payment within this first month.
Are they current now?
The
No.
fine will be $291.75.
They haven't paid yet?
They have not. I've spoken with the town clerk.
And they've done this before.
Yeah, we had to do this back in 09 too, for this time.
Motion, please.
Motion.
Is there a second?
Second.
Is there any discussion? All in favor?
Aye.
Opposed? Carried. Approving memorandum number 13 of the CSC Coordination of Holidays with United Public Service Employees Union. Those are the highway people. And our move here is to try to get the same holidays for both unions, right, over in that office?
Correct.
Yeah, it's more of a housekeeping issue. When we approved the highway contract, they swapped out a holiday, if you remember. They used to get a half day on New Year's Eve day and a half day on Good Friday, and they swapped out, they wanted all of Good Friday and not get New Year's Eve. We need to do that with Jay's clerical staff too, so that when the office is closed down there, the office is closed. It's really just a housekeeping.
Do we know if CSCA is in agreement with that for those staff?
That they've approved it, and they've already signed the agreement.
So moved.
Second. All in favor?
Who said
Aye.
that?
Bernie. Opposed? Carried. Approve extensions of alternatives to incarceration contracts, number 14. Jim?
I think Lenny could probably give us the best explanation.
You see it?
No.
Oh, of course he is.
I mean, we're being proposed a contract, correct? The extension of a contract.
Absolutely.
How much deterioration in the reimbursement from last year?
It's about the same amount then.
Really?
Yep.
That's the first time in a long time it hasn't deteriorated further.
But that doesn't mean that won't
No,
change over the next
because of
month or
their
so.
calendar year and ours.
But
Absolutely.
they're amending it to put the calendar year differently, right? Is that what you said, Jim?
Yeah, it'll go through, instead of January 1st, 2011 through December 31st, it'll go through June 30th of 2012. So we're going from 12 months to 18 months, which tells you right there something may happen.
Yeah.
Mr. Chairman,
Yeah.
there's a lot of information that's included in that, and I appreciate getting that. I'm just curious, it indicated about the alternatives board and all that in the contract, the makeup of the board, ensuring this, and meetings and things like that. I asked one point to be notified when the ATI board meets, and I haven't been able to get that information. I wonder if we can make it routine. I don't know if any other legislators are interested, but I'd like to know when they meet.
You're a regular schedule.
Yeah, we meet twice a year, Pat, we put it in the paper, and we'll make sure all legislators know.
Is it only twice a year? I thought there was something in
Quarterly?
here.
That was changed about a year ago, right?
Quarterly.
The state didn't require us anymore to meet quarterly.
And but the contract here is asking about the frequency of the meetings and the attendance at the meetings and the people that are on the board, and is this nothing new? It's the first time I've seen this letter, so I don't know if it's new verbiage.
That's pretty similar.
I think it's about the same as we
Yeah.
did before. I don't, there's nothing really outstanding.
If I can have that, know when they meet, I appreciate it.
Absolutely.
I think we got that on our website too, haven't we?
Yeah. Yeah, we have, that's a public meeting that we have to advertise.
Can I get a note, please?
Yep, all legislators will get it.
All in favor?
Aye.
Opposed?
Who moved that in a second?
No, we didn't have a motion, did we?
Yes, we did.
I think I moved it.
Dennis and Bernie.
Yeah. No, that's what it was. Number 15, amend ethics laws for titles and DSS. So are we adding some?
Tim, any changes?
Yeah, there's a few changes here. I'm trying to figure out why some of these were and some of these were not required to do this, but they are all policy decision-making authorities. They all have that authority. So there's probably 4 or 5 of them that have been added to it. These are all the directors and coordinators that report directly to me.
Are they all non-union employees?
No,
They are not.
I think there's 2 CSEA.
Commissioner, head social welfare examiner, director of administrative services, Director of Social Services attorneys, 2 of them. Special assistant to the Commissioner of Social Services, personal staff developer, managed care coordinator, WMS coordinator, social services employment coordinator, child support enforcement coordinator, and country manor superintendent.
The question I had is just that if they're unionized employees and they're a whole different salary schedule, I'm just curious why some are in one salary schedule and one is in the CSEA. If there's not, I thought it was a clear distinction. Policymakers were in 1 and 2 and.
We've tried over the years to take some of these positions out, not
I
just
bet they had
these,
to put them in and we don't pay the health insurance.
not just these, but others, and have not been able to do that. But they are supervisory, and we have a couple others, Steve, correct?
I'm not advocating taking them out of the union because then I know there'd be some that would think that that might make it easier for us, but then again, we bear the full cost of health insurance when we do that. I just find it, I mean, is there any problem with making them policymakers and decision makers and having them be union?
We've been very fortunate in not having trouble with them.
What are the positions that are union?
WMS coordinator and, WMS coordinator and the.
Social Services Employment Coordinator.
And the child support coordinator.
That's what 3.
And they're gonna have to fill out financial disclosure forms and everything else.
Correct.
Did we have, yeah, we did have a motion. Is that all in favor?
Aye.
Opposed?
There was no motion.
That's true, we can't let them vote.
There was no motion.
There was no motion?
No.
And there's no other
I'll
way
make
of
the motion.
review that has to happen on this other than just for us to say it?
Did
Is
you
that
make
it?
the motion?
I just did, I'll make.
They can always petition, Charlie, please correct me if I'm wrong, they can always petition to the Ethics Committee. I know, I remember Mr. Skavinsky doing that probably 15, 20 years ago. They have the right to do that,
To the ethics board?
yes. To see if, it, you know,
Curtin Dutch, Jim.
okay, thank you.
All in favor?
Aye.
Opposed? Carried. We have some transfers to approve. What are the transfers?
We got $3,000 for HEAP, from salaries to contracted services. We have $3,600 from Youth Bureau to Youth Bureau retirement. We're starting to see, guys, an awful lot of the kids join. We spent over $10,000 in retirement this year.
Jimmy, are these transfers to complete 2011?
2011,
Okay.
I bet you they won't under tier 6.
That's probably why they joined.
absolutely. So they're just small ones, Pat, but they need to be done.
Is that the only two?
As we speak right now, yes.
These are bookkeeping to clean up 2011.
Correct.
not
And they're coming out of
transferring
their,
into 2012.
coming out of their accounts then to take care of them.
So
Not out of contingency.
So moved.
Okay.
Of course.
Any other discussion? All in favor?
Aye.
Opposed? Carried. Approve assessment contract with Town of Fairfield.
Oh, geez, we're way early, Pat. Can we go to the back of that?
Yes, you look at, you skipped.
Just move.
17.
We're moving too fast for me.
Oh, I'm sorry.
Mary Ann's coming in about 8.
Number 17, I had marked it down. Approve temporary full-time position in treasurer's office. This is due to a person being ill.
Is this an outside recruitment?
No, it isn't, is it?
No,
Where are they coming from?
part-time in the office.
You're
And then are
going,
we backfilling the part-time?
No,
No?
Any idea how long we're projecting to be part-time or temporary?
it was catastrophic then. However,
okay, Dennis is it first? I need a second. Bernie. All in favor?
Aye.
Opposed? Carried. Do we still, on the next two, do we need to wait?
Probably not 19, if you know what they are, then.
no, I could do 19.
These are the ones over 2,500?
Yes.
Okay, and what are they?
people in the town of Russia, where the school bill was paid twice, $4,569.89. The property was in Russia and the people live in Camillus. So that they paid the $45.69 twice.
And we just have to give them the money.
Absolutely.
So it must have been re-levied.
Yes,
Okay.
absolutely. Sorry, Ben, thanks.
I need a motion.
So move.
Second.
Any other discussion?
But they must have thought their taxes really.
All in
Yeah.
favor? Opposed? Carried. Do we want to go into executive session, Ray, on number
I
3?
think the other one, yeah, we really need it again.
Okay. Okay, we'll go back to 3. I'd like to go into executive session for the Human Resource Committee.
Purpose?
The purpose is we're negotiating contracts.
Proprietary information from the 6 agencies.
Second.
We need one for Ways and Means, too. Herb and Bruce. Ways and Means, all in favor? Opposed?
Okay. Everyone okay?
So we're gonna, want to look at the contract with the town of Fairfield for assessment services.
Yeah, and I think, Pat, the committee remembers that we talked about this. I think it's really a discussion for this time, right, Mary Ann? Not really ready to go with it.
Absolutely. They're
Yeah,
just
but the
looking
point
for
is,
information. They're asking if we would.
We had that discussion, I think then you brought it up. Do we stay in the business or don't stay in the business, so. and I
Budget
think-
time,
And I think everybody knows,
In light of
unfortunately,
Mary Ann leaving.
thank you for all you've done for us. We're gonna miss you. The applications are out, we'll have them by tomorrow, and we'll come back to Pat's committee shortly after to take a look at that, and hopefully Mary Ann can help us with that a little bit too. But I think that we wanted to have a discussion, where do we go with the
Is
assessing
it
unit?
data processing or is it the full service? What are they asking?
No, they're looking to come, well, it's only the supervisor has approached me.
Okay.
He wants to know if we would be willing to take them back. They're not completely happy with where they are right now in their assessing unit. So it would be for complete services. And it would be
Change the
at
town
I
clerk.
believe it would be at the $15 parcel.
Okay. Do you know of any other towns that might be, I mean, I know Fairfield obviously is just, are any other ones even contemplating it, Mary Ann, that you know of?
Kurt,
Not that I know of.
I think Little Falls is, isn't it?
Well, we have.
The city of Little Falls is already with us.
Can you, off the top of your head, Mary Ann, can you tell us who does
I mean,
kind?
I know that there are towns that are not happy with the way their assessing units are working. However, they are some of the smaller towns in the county, and they don't have the financial means to come to the county.
Because of
Not that
our,
they wouldn't want to, I think they would take us up on it in a minute, but I don't think they could afford it.
Who does contract with us and who
Who
does?
does contract with us? Let's see, there's Columbia, Litchfield, Winfield, Danube, the city of Little Falls, and the town of Frankfurt. And then, of course, we do Salisbury and Herkimer, we do data collecting there.
Yes.
and how long would this contract be for?
This contract, what could be for any length of time? Our contracts are all different. Some are multi-year, some are year by year. Most of them are year by year.
Would
Well, what did
it be,
he want?
He didn't specify.
There was a contract.
Mary Ann, would it be, is there still the consortium reimbursement for like the 3 townships that go together and?
If we form a new cap, I think that some of that money is still there, but with all that's gone on in the state, I'm not sure exactly what they're all.
Because there was incentives.
There was incentive, I think it was $10 a parcel for a period of years, and if they broke it up before maybe 10 years, then they had to pay some of it back.
Now, under the terms and conditions of that CAP program, weren't they mandated to do a reval every so many years?
No, they were mandated, I think, at the beginning to do the reval, so they all started out on the same equalization rate and the same level. And then there was the annual reassessment that went by the wayside.
But I mean, to continue to receive the state aid, wasn't there a mandate, within 8 years they had to do a reval, or 6 years, or?
That was if you were on annual. If you were on annual, then every 6 years you had to have a full-blown reval. And in between times, you did analyzing your sales and whatnot.
But you were able to maintain 100% equalization rates?
Yes.
If you were on that program and
You were on
then
the
went to a
annual.
reval every 6 years?
Yes.
Okay.
And you had to submit a program.
Would
to
it be
the
wise
state.
would it be wise for us to get into that kind of a contract with townships that want the county to do their assessing?
If you were going to do that, you would have to have a person on staff that would be able to do evaluation. We've been, up
Like an
until that
appraiser.
point, right.
Okay.
Up until that point, we had been subcontracting with Basil Associates. He did that part of it for us, we did everything else. So there is no one on staff that would be able to do that evaluation part.
So Basil we bring on if we have a township that's asking for the,
Right,
Okay.
somebody's asking to do a reval, then we would have to bring someone like Mr. Basil, not necessarily him,
But someone
that
who's
type of
certified to do-
person,
okay.
that kind of expertise.
why doesn't the state just mandate 100% assessing and this thing would be solved?
Their taxation and finance is getting their hands into the assessing side of things quite a bit, and I think we'll see some changes made in the assessing area pretty soon.
I mean, it's still dark ages.
So they're
A lot of
looking
this
for a
state-
contract to begin July 31st.
They're looking for a contract to begin July 1st, no. I'm not sure when he would begin the contract, because they currently have an assessor. It's under, he's appointed for 6 years, so they would have to dismiss him.
Would Jim?
Well, this says July 31st.
Well, that was a sample contract I sent him,
Oh.
because that's the date, that was the date on the sample contract. But, I mean, they have not a appointed, 6-year appointed assessor, and they would have to arrange to have him leave, and he would probably have to resign his position. And that's why I said, this is all very iffy, but I didn't want to solicit without bringing it before you, because I wasn't sure how you felt about it anymore, and I didn't want to get us in any deeper than we were.
Well, we lose about 120 there a year, Jim.
That's what Mary Ann, we had thought, right, last year,
But the thing, the point
with
is-
benefits, et cetera?
Right, but the point that we've gone through the effort now, it was never going to be a money-making project.
No, that's not
because-
how we approached it. You weren't here,
I understand that.
unfortunately, but we
Mr.
did approach it
Wilson.
as a money maker.
I understand
Or
that.
at least break even.
But the point of the matter is, if you're going to compete with outside assessors, they're going to charge less, because they don't have to deal with the benefits, the unions, the rates, so they can offer the service to the town for less money. But at this point now, we've put so many years into it, we have 3 trained assessors on staff, and if the state moves in that direction now, where more towns are looking to come to the county, or the state is gonna mandate, if we were to get rid of what we have, and that, say 5 years down the road, the state mandates county assessing, now you have to go back out and get your people again, train them, set them all
Well,
up.
wouldn't you have assessors already out there if they were mandated?
They're not gonna come and work for us necessarily.
Who would they work for? They'd have to work for a county. or a
First of
mandated.
all, there are quite a few assessors that are probably ready to retire within the next few years. Our assessors are probably amongst the youngest that are in the county, and Bruce can attest to that. So it just seems to me that after you've put this effort forward, you've trained these people, we've equipped the office, They know what they're doing, they know about the RPS program, they can help answer questions for the public when they have problems with their tax bills. It just seems silly it just seems silly at this point to throw that all away and maybe have to start from square one again and build that program back up. You've been in the program now for like, well, it's before me, so it had to be maybe 10, 12 years.
Well, it's probably 10.
And, I mean, there
Mary Ann,
are,
has a township
It
ever
hasn't
left
worked in
us,
10 years.
once we started doing it for them?
Fairfield left us because they
But
weren't.
that was a brief encounter. That wasn't very long.
Well, they were with us probably for about 4 years.
But I mean, nowhere near as long as Columbia, Litchfield, and Winfield.
Oh, no, and Columbia, Litchfield, and Winfield are perfectly happy with it.
Yes, they
They
are.
have no problem. They go to their supervisors' meetings and they brag about county assessment, and I do really believe that more towns would come if they could afford it. They just can't afford it. The services that we offer are next to, I mean, you can't get better services than what we do,
I know.
both to the public and to the towns
It's a
themselves.
real damn if you do, damn if you
There
don't
are,
type of
there are
situation.
staff
It
people
really is.
that if I were looking at retooling the office, I might suggest that everybody on staff be a trained assessor, not necessarily working in that capacity or paid in that capacity, but just be there in that capacity. Instead of having, you have a clerk here and a clerk, they're not able to accommodate assessing. But if you had, like, the people on staff were assessors, then should a town approach us at any point in time, you would say, well, oh, certainly, we have a person here that could serve as your assessor. But if you get rid of them and you have only clerks left, you'd be back to start all over again. I think the program that you've built up is an excellent program, and to just throw it away at this point,
It wouldn't be a question of throwing it away, it would be a question of saving taxpayers money.
well, you've got other staff people that you could save money on. I mean, mine is not the only department that has staff that could be weeded out, I'm sure.
Oh, it's nice to be ready to retire, huh?
Yes.
That's
Yeah.
swell.
So that's an FYI. That Fairfield may be asking for service.
I don't know, I haven't pursued it, because I
Right.
haven't wanted to
Understood.
send him anything, so that's gonna be up to you. If you want me to pursue it, I will, and if you don't, it's entirely up to you.
When would this, they're looking for when, Pat?
No, she said it was just a
No,
generic
that's just the
contract.
date
It
I
said
put on
July.
there.
Right,
It was
okay.
just, it was the
Okay.
supervisor that approached me that said, if we wanted to come back to the county, would the county take us back? Could you send me something in writing to let me know what it would cost and, you know, if we would be willing? So I did, I got it all prepared, but I didn't send it.
Why are we taking a loss? If we get a good bad deal, then charge more. If you want in, fine. If you don't,
It's not that simple.
well, they want in, but, you know, the rest of our districts are paying for
I
it.
know.
Mary Ann, did you quote them yet, Fairfield?
They would be $15 a parcel, I believe the parcel count was,
Raise the price.
$15
Yeah, but did you tell them that already, the 15 or?
I haven't told them anything. They're still waiting for me to get back to them.
You should tell them 17 parcel or something.
Well, then
Then
you gotta tell the other townships the same.
Don't forget, we have
so
like
be
a
it.
sliding scale,
I
right
think
now.
No, I
So
understand.
There's the
I
tops, and
understand.
then there's 10, and there's 9, so if you wanted to adjust the amount of money that we were charging per parcel for next year, we haven't raised our fees since I started. So I suppose if you wanted to increase the fee per parcel, that would be an option. I still don't think you're gonna make enough money to cover benefits and salaries, and I don't see that happening. But it's a good program, it's a good program, and it offers a service to the public. And I know that each town doesn't partake in it, but over the course of time, we have worked within most of the towns in the county, whether it be for data collection, revaluation, assessment services. We have offered and helped many towns that are not our assessing units. We've worked with them, and again, whether it be for data collection or helping them with valuation or one thing or another, many of the towns, almost, I would say more than half of the towns have come to the county at one point in time for some service.
This is when I said budget time, they cherry pick what they want.
That's how we set it up.
I know that's how we set it up.
The service
I
was
know.
offered, it was offered, and, you know, you pick.
Is it time to raise the rates?
As soon as they're done hearing that you raise the rates, they don't want to pay them, so.
Why
Yeah,
not?
how long did you say it was since we raised the rates, though?
I think we raised them, like, maybe the second year I was here, so I would say probably 7 years.
Can you raise the rates enough to cover the office?
And index it like we do the snow removal contract, we'll be all set, right?
What's every dollar on a raise come out to be total right now with our contract?
Depends on how many parcels.
That's what I'm asking.
Yeah.
Total, how many parcels does the county do now?
6 towns you have to look at.
That's what I mean.
With all the
Ballpark it.
Well, Frankfurt's got almost 4,000, Little Falls has got probably 2,000, and the Denise's towns probably come up to not quite 1,000 apiece, so another maybe 3,500 parcels. So, quite a few, but there's 40,000 parcels in the county.
We'll at least cover our costs.
Yeah, if you would have 7.
Mary Ann, how many parcels in Fairfield?
In Fairfield, offhand. I
Oh,
don't
Fairfield?
know.
Yeah, just rough.
I got
have
it.
over 1,000, but
Wait,
I'm
wait,
not.
wait, choke it away.
We'd have to add that in.
Oh, 20. I just did it. It's 25,000 and something.
Maybe they had less than 1,000.
2,500
No, no, I'm talking about total
Oh.
revenue.
of all of them?
Half that.
It was 1,000 something.
What's your figure? You know, we have to worry about
Yeah.
our budget, they have to worry about theirs. If we're not swinging
At
it.
$15, there was, it says here, there was,
Can't afford it.
If you shoot them at 17, they take it, then we look at raising the other ones.
You don't even know if 17's gonna cover it, though.
Well, that's what I'm saying, I mean, to figure out a price where we gotta be and then throw it to
You're
them.
talking 20s.
So close. Still $100
We've
short.
gone
that what
over
it
this
is? Yeah.
before, and
Yeah,
I-
yeah, minimum.
the only way I would figure it is I see the
Covered.
salaries. I don't know what goes into the benefits. I've asked for that information before, I've never gotten it. So
Mary Ann, you and I have gone through that this year when it was 124,000.
We went through
You and I went through it.
what the benefit part was?
Absolutely.
Well, then I don't remember
Yeah,
seeing it.
we definitely did. And you weren't happy with the 124,000, but the number's the number. And
That's
a lot of it
including-
is the.
That's including the salaries, or that's?
Yeah, absolutely, including soup to nuts.
I got 15,255. Maybe divided by 50.
A little over 1,000, Pat.
1,017.
Most of, each of the assessors cover their salary, they take in enough to cover their salary with the exception of the Little Falls. The other two cover their salaries with what we take in.
And they're all at the current, the same rate.
And this is all being driven, guys, too,
Yeah.
by the mandates that we have. And the 2% cap. And where do you go? I mean, it's not that people are looking to not do the service, but you have to decide.
Right.
This is not mandated in our end.
It says the town of Fairfield has 1,017 active parcels.
Are you asking me that?
No, that's what it says on this.
Oh, okay.
We have to decide if we're gonna be in this business or not, and maybe we should just, if we're gonna phase it out, then give everybody a 1-year ride on it and say, hey, after 2015, we're out of the business. We're just losing money. And give, you know, don't dump everybody, you know, cold turkey, just,
We're gonna dump
You ever
it.
sent the letters out to the other towns like they were gonna do? To let them know which.
Did you-
dialogue's good, Fred, I don't, you know, maybe we should bring them in and,
Solicit it.
That's not our job.
Well, let them know that we're facing a deficit and then we're thinking about abolishing it and if they can afford to pay
Dennis
more,
brought that up back in,
It's either gotta go one way or the other.
you know,
It's either gotta go.
bring them in and see if they can afford to pay more and if they wanna continue that way, then fine. If they don't, then we're,
You know, when Mary Ann's position was created, back in, when Jim Spanfelder took it, the legislature was, I want to, early 70s. The state was saying, well, it's going to go to countywide assessing all over New York State. It never got there. It never got there. So,
they said it had done in the 90s,
yeah,
early 90s.
I mean, we did a study. And the study recommended county assessing, consolidation was feasible, but the study recommended it. That it was feasible, logical, consolidation. Never went anywhere. $25,000, did we get for this study? $50,000 from the state.
25 after, Marion, right?
From the state. The state gave us $50,000 to study it. We came up with the conclusion it would be best if it was consolidated at the county level. Nothing ever happened. I don't know.
I don't know.
Okay.
I suggest we do that, and we bring them in and say, hey, listen, we're facing the deficit here. We're thinking about raising our rates, bring everybody in.
That was suggested
Well,
back
then
in
I'm
October, why
suggesting that
wasn't
we
it
do
done?
it. Well,
I'm not chairman of this.
I don't know, neither am I.
Has nothing to do with Chairman.
What about somebody going to the town supervisor meetings or something like that? Is that a?
We can
We
bring it up.
actually, we brought that up.
We could, yeah, I think we did bring
No.
that up, going to the supervisors association.
Maybe they'll bring them here, go there.
We did go last
I
year.
mean,
Face is better.
If I thought we'd get there
I
with
would be happy to do
50% of the townships in 3 years, I'd stay with it. But if we aren't gonna be any more than what we're doing now, it'd be hard to justify continuing.
Well, it's been out there for 10 years. You'd think if they wanted it, they would come.
But I mean, I think if the discussion is, we can't keep going the way it is unless there's more support, it may have them, like you say, some of these assessors are getting ready to hang up the shingle, right? And if that happens, maybe more townships might be interested. I don't know.
And I remember the state coming in and doing that presentation that if everybody got in it would save something over 400 grand.
Yeah.
Right, I'm saying if.
Well, if we did our highway consolidation, we'd save 850,000. Where's that? Same spot.
If you merged 4 school districts, what would you do? I mean, where are we going?
No,
I know, Jim, I know.
Well,
the data is there.
I could,
I agree with Fred, the data is
Yeah,
there.
the data's always there.
I could broach that at the next supervisors meeting. I'll go and I'll say, listen, we're considering raising our rates because it's just not cutting it. And,
Either they're taking it or they're going.
Raising the rates still isn't gonna do it. You gotta have the participation. Then,
Rand, does any of your people go out and try to solicit new business?
I think the assessors know.
Would that be something that you might be inclined to maybe ask them to do to maybe, I mean, if you're gonna save your job, I mean, I don't want you to put it at a fear factor there, you know, you go out and solicit it.
I don't think that that's the problem. I think that it's the money, because they can get assessments, or, for instance, the town of Stark, they're still paying the guy what they paid me, $4,500 a year. That was 9 years ago. Those people are paying like $8 a thousand for their taxes, just for town taxes. They cannot afford to pay $15 a parcel. Not that they wouldn't, Stark would love to come to the county. They cannot afford it. This is a service that it was never should have been a money-making proposition, because it isn't going to be.
No.
We cannot compete with an individual assessor who's running a business out of their home. They don't, first of all, they don't have to work full
You don't have the overhead, I understand.
So we cannot compete.
Yeah, but you said, but Mary Ann, what I'm saying, you made a good statement right there. That's why I say you have to present it as a package. That's what I'm saying, get all the townships together and say, you know what, and I'm not try to demonize their assessor, but say, this is what we can offer. If you have a question, we're a phone call away. The service might entice those people to say, you know what, we'll cough up a couple more bucks. You never know if somebody's gonna buy something unless you show them the right goods. You know what I'm saying? It's all in presentation.
They're all towns, they're no villages, right?
But if they ain't got it.
They're all towns that-
And the city.
Yeah, but if they feel
Okay,
that.
well, that's good. We'll get the info and we gotta decide one way or the other. what we're gonna do.
I got a question.
Do we have anything else for Mary Ann?
No.
Yeah.
Thank you, Mary Ann.
And when is the official date?
March 30th?